Hello, everyone. This is Florence Champagne with the Open My Heart Foundation. And thank you so much for joining us tonight. We have a very, very important topic that we're going to discuss. But just to let you know a little bit about myself and the organization, my name is Florence Champagne, and I'm the founder and CEO of the Open My Heart Foundation. And what we have once a month is support groups called SOS, supporting our sisters. So that's what we're here for tonight. And our hope is to educate people, give them something else to think about that they may not have thought about in reference to COVID-19 and how it has impacted all of us, and to discuss the fact that everything is opening right now. Are we out of the woods yet? So that's an important question. We have doctors on board. We have testimonials from people to share with you today. So I thank you for joining us. If you have a question, please go ahead and type it in the chat box, and I'll be checking from Facebook Live. I'll be checking the chat box periodically. So we've got the Delta variant out there now. We're going to talk about that. And, you know, schools are open. Some schools are shutting down again. Restaurants, bars, gyms. You know, you would think that everything is okay now. So, you know, we're going to talk about that. And one of the things I'd like to start off with is the fact that COVID has impacted all of us in some way. Everyday people, COVID is impacting our lives. Real people that we know that have had COVID. Some of us have had COVID, and we have had some losses due to COVID. So this is an important subject. And we are so honored to have one of our guests with us tonight, who is my sister, Jackie Mims, and she's going to go up first. I'm so honored and blessed that she agreed to share her story. Jackie suffered a real traumatic loss in her family, her mother, the matriarch of her family. So to share her story tonight, we're going to get started and just have Jackie tell us a little bit about her mother, what she was like, and the impact that she's had, her loss has had on her family's lives. So without any further ado, we're going to get started with Miss Jackie Mims. Jackie?
Hi, Florence. Can you hear me? There we go.
Hi, Jackie. Okay.
Hi,
So
Florence.
let me see if I can highlight you. There you go. Hi, Jackie. Thank you so much for joining us.
Oh, thank you so much for having me on. I appreciate you, Florence, and I love you, and I thank God for you. And it was just a conversation that you and I had just last week, and many have asked me to share, and I just had a conversation with you, and it was a warm conversation. I thought maybe it was time, but just to share a little bit about my mom, wonderful woman of God. My mom was affectionately known as Nana. That's what we call my mom, Nana. My mom loved the Lord and definitely called according to his purpose. We lost Dad 36 years ago, so I was a teenager. So my mom opted to never marry again. but to marry herself to the Lord and to focus on her family. I'm one of 14 and I am the baby. So I just wanted to share with you what happened to my family when we suffered the loss of my mom due to COVID. It was just my mom went to get her infusions. She's anemic, so she went to her appointment, and they really, really felt like my mom's oxygen levels were low. So because of that, they wanted to take her over to the ER. And taking my mom to the ER, they suggested that they would admit her and keep her overnight. And then we spoke with the nurses in the morning. And the nurses in the morning did share with us that my mom needed 100% oxygen, and they would recommend her getting on they would recommend that she should be intubated. So we said, okay, and not knowing, mom was intubated, and that was in April, actually, at the end of March. And on April 6th, my mom passed away. So it was 8 days in the hospital. And that was just it for us. But more importantly, my mom, I spoke with the doctor on that Sunday, and she struggled during that weekend. And not to mention, I did have a family friend, Rick Black, who's a registered nurse of 30 years, and my sister Vanessa. We kept tabs on my mom so many times a day. And the last time we were able to see her, because they do set up a little video conference, if you will, and we got a chance to see her. And then the next day, we spoke with the doctor. And I said, well, how was her weekend? They said it was tough. She was struggling, but I'm thinking, okay, struggling. And then she said, I think you need to prepare your family to say goodbye to her. And I'm like, goodbye? I just spoke with her last Friday. She's like, yeah, she's struggling, and it's not really much more we can do. So our world has been shattered, flipped upside down, and I cannot tell you the pain that we are feeling daily. And we had two options. It was either the ground or the crematorium. Those were the options. We asked, can we see her? No, we wrapped her twice. When she gets to the next location, she'll be wrapped again twice, but you can't see her, and there'll be no autopsies because it's COVID. So that was difficult for my family. So right now, my family and I struggle every single day, and mainly holidays, because we're a big family and we love one another. And my mom always sits at the head of the table, so we do have an empty seat in the house. My mom is no longer there, and I can't tell you how crushed my heart is. I can't tell you how crushed my family is, but we're just crushed trying to make sense of this. And as it stands right now, we can't make sense of it. So part of me is very, very angry. And part of me is broken, like in a million pieces. My mom was my best friend. I was the baby girl, so we know how it is with babies. It's so much more, but for the sake of me keeping myself together, that is all I can share without breaking down, because of where we are right now. We're hurting really bad. We're hurting, and it just feels like, we're just, I don't know, we're just on an island by ourselves. And honestly, I've just been
You did a great job,
Just been
Jackie.
waiting for her to come home.
Jackie, you did a great
Yes,
job. Thank you so
thank you.
much for sharing, and I
Thank you.
certainly will respect your limited time of sharing what you can, as difficult as it may be. Um,
Thank you.
at this point, I'd like to ask any of the panelists if they have any words for Jackie. We know that this was a traumatic loss in her family. It's not easy. Um, any closing words or thoughts? I appreciate you so much, Jackie, being on here. I do know that Jackie needs to leave a little bit early, so she would. But I'd like to ask the panelists: does anyone have any words or thoughts for Jackie?
Can you see me? Jackie,
Yes, I can see you.
this is, I know you remember Terry and Rick Peters from the health fair.
Hi. Yes, I
And,
do.
and I am so sad to hear about what happened to your mom. And I just want to just encourage you because you were such a bright spirit in our whole health fair when we did it. And to see you suffering right now. And I've seen working in an all COVID hospital at University of Maryland in Laurel, your story hits home because you're speaking from the other side. I see it from the inside and saw what your mother probably went through when she was in the hospital. So my heart really goes out to you, and I definitely would like to keep you and your family in our prayers. You remember my husband Rick? Rick
Yes.
too.
Hi.
Yeah. So we really, you know, grieve when you have to grieve. You're allowed to grieve. And if you feel like crying, you cry. Just let it out. Just don't hold it in. Feel free to just feel that because you loved your mom, you were close to your mom, and hold on to those memories of the good times that you had with your mom to get through this.
Thank you.
I like to say that, of course, there's no words that can be expressed by anyone at any time to take away that pain. I know I've been through it. I had a triple from year to year to year. And so I'm still grieving even 7 years later. But the power in it is that you allow yourself the freedom and the glory to breathe and take that in. And as you come out of it, you want to take all that feeling and put it into the memories and the strength that you know that those family members that you're missing or the family member that you're missing gave to you and believed in you. And you take in that spiritual part that you know that they're still with you spiritually and they're still watching over you spiritually. And they want you to miss them. They also want you to carry on, not just for yourself, but for your family and who they created you to be. They were proud of you. She was proud of you before she left, and she's going to be even more proud of you now because she's watching everything that you're doing. So there are times when I still, 7 years later, I just may be driving down the street and I'll see something or hear something, you know, a song. My mom was a church mom, a song. I'll see a lady with a church hat, look like my mom, you know. You know, somebody
Yeah.
coming to the pharmacy, I'm like, oh, God, it look like my mom. And you know, it just may bring that tear up. I just go to the bathroom, go in the back room. I take my tears. I enjoy those tears, and I come back and say that was just her visiting me, you know, at the time, making sure that I'm still doing what she wanted me to do. And I know your mother will want that from you. We want you to continue doing what she put in you as the wonderful woman you are today.
Thank you so much.
Hi, may I make a comment as well?
Yes.
Hi, Jackie. I'm Dr.
Hi.
This just, gives credence to the fact that these patients aren't just statistics during this pandemic. They're there are real lives and real families who are hurting immensely. And as physicians, we were taught to have detached concern. But COVID has changed all of that. I think everybody's been impacted some way or other. So I feel your pain. I feel the grief you're going through. And it's okay. Just know that I myself had added you to my prayer list.
Thank you.
And yeah, and I think everybody on here feels the same way. And I'm sorry for your loss. And my condolences to you and your family.
Thank you so much. Thank you.
Florence, I think you're on mute.
Okay, yes. Thank you, Jackie,
Thank you so much.
for sharing once again. Love you, girl, and you know that you are in my heart and in my prayers. So thank you.
Thank you.
Okay, Dr. Nickins, as I said at the onset, everything is opening back up. You know, schools, gyms, entertainment venues. Is it safe out there? Are we out of the woods? You know, you would think everything is okay. And you know, then we hear the Delta variant, which is more contagious than COVID-19. What does all of this mean in light of the fact that everything is opening back up? Or is it safe out there?
Yeah, well, thank you so much, Florence. Can everyone hear me?
Yes.
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 Right. Well, it's a privilege to address the group, and I hope I can provide some clarity about the current status of the pandemic and mostly I'm here to answer questions. First, I must have such respect and gratitude for hearing, for the sharing of a really terrible loss, but it puts the human cost of this pandemic in front of us. So I have a Nana, and I can't imagine, my Nana was my grandmother, and she was 98 when she passed. And the isolation associated with this disease, that the person is hospitalized, they have difficulty, but for safety, they're isolated. So it's really very trying, very stressful. And sharing that story, I hope, makes everyone pause when they think that this is not simply a flu or, a bad cold, that the consequences of becoming infected are quite severe and can, as unfortunate does happen, leads to death. So I'm sure everyone knows that this pandemic is the result of a coronavirus called COVID-19, and it's a worldwide contagion, and it's spread by aerosolized viral particles. So we know masking has been an inexpensive and useful public health measure to impede transmission. It's not perfect, but it is a barrier to the aerosolized virus that is contaminates a room, any closed space, or if you're too close even outside to someone who's infected. Vaccines, specifically, we have an mRNA approach, both Pfizer and Moderna, 2-dose vaccines, as well as a more traditional vaccine, the Janssen's J&J single dose. These vaccines were developed and really have proven extremely efficacious in reducing the spread of infection and dramatically reducing hospitalizations and death from COVID-19. Now, unfortunately, the higher number of infections, in other words, the concentration of the infection that's around us and the length of time that we have very high concentration of disease, that contributes to the virus's ability to mutate. And in mutation, that can change the ability of the virus to make the virus more invasive, more contagious, if you will, cause more damage, be even more lethal. And the dreaded mutation is that it mutates to something that resists the vaccines that we have in place. So the Delta variant has proven to be more highly contagious than the previous strain of coronavirus, COVID-19, that was the initial two surges of the pandemic in this country. And the Delta variant now is largely responsible for the new infections and the current surge in some places. The effect of the Delta variant is that hospitalizations have, which have increased in certain areas. Maryland, our metropolitan tri-state area is actually, there's some rise, but it's well below any peak levels. But as we know, in some places, their hospitalization and death rates have really soared. But importantly, the hospitalizations have changed, that the persons hospitalized are no longer just elderly, vulnerable patients that are vulnerable because of comorbid disease, but rather they're younger, healthy persons, including children. But fortunately, the vaccines, all of them, Pfizer, Moderna, and the J&J single-dose vaccines, remain effective in reducing hospitalizations and severe illness. So some 101 about the virus. The virus needs a host to survive. So again, masks slow the spread. Social distancing or avoiding exposure is an effective way to contain the virus. The virus can be transmitted before or irrespective of the host having symptoms. So one of the things that makes this virus so difficult to get under control is that you can have the disease and transmit the disease to someone else, even though you yourself may not even be aware that you are carrying the virus. Fortunately, vaccines are effective, but at this time, vaccines are recommended only for persons 12 years or older. So vaccines for children 5 to 12 are under evaluation, and they're not available now, but the good news is that they may become available as early as the fall. And when that happens, that represents an important game changer for how we're able, our confidence in being able to get on top of this pandemic. So, protecting our children, of course, is a high priority, and return to the classroom is also a high priority. So can we do that? So again, children between 5 and 12, these are school-age children, there is no vaccine. So they must rely on the physical barriers to minimize exposure. So fortunately, a sensible approach that's outlined by CDC guidelines makes it safe for children to attend school. The schools must have proper precautions, including adequate ventilation systems at the schools, required masking, social distancing, at least 3 feet, and very important is that anyone who has symptoms suggesting that they might have an infection or ill, they must stay at home and isolate and test to see if they have coronavirus. And if they do, that isolation as prescribed is at least 14 days until they clear the virus. But by practicing these barrier methods, it actually is safe for children to return to school. And we have Israel as an example and the United Kingdom as examples that it can be done and the kids can learn and enjoy, not normal because there's masking there. And obviously the pandemic is still a concern, but it is a return to classroom learning. And it's very important for our children. It's important for the parents, for the families. It's a return to normal. I should also mention that ideally, adults who come into contact with children should be vaccinated. Most of the school systems are requiring that the teachers be vaccinated unless there is some medical reason or religious reason that prevents vaccination. But those individuals really shouldn't. They have the risk of exposing children to a disease for which can be severe, and they cannot be protected by vaccination. So I think this is perhaps a good time to stop and answer questions. I'm pleased to do so if anyone would like to comment or has a concern about their child, or how, what are their options.
Okay, thank you, Dr. Nickins. And I failed to let everyone know that Dr. Nickins is from NIH, the National Institute of Health, and the director of the, I hope I say this right, Heart and Lung and Blood. Is that correct, Dr. Nickins?
Well, I'm sorry, I'm not the director of the
Okay.
institute, but I am a medical officer in that institute.
Okay.
My director is Gary Gibbons, but Anthony Fauci is the director of another institute, NIAID, and I happen to be part of a large trial involved with NIAID. But Dr. Fauci, whoever I think everyone has heard speak about the virus, is my director's counterpart in the NIAID. That's the institute that is directly charged with fighting the infection aspect. But the Heart, Lung, and Blood Institute has also been very involved in developing ways to monitor some of the complications of the disease, as well as using a clinical trial network. We have something that's called Active 4, and it's really a tremendous effort that has organized recruiting centers across the country that has allowed rapid evaluation of possible treatments, and dismissing treatments that are thought that might be effective, and but a tremendous effort on the NIH. All personnel like myself are very involved in trying to identify treatments and therapies. But again, I wanted to underscore here the return to school and the information that I think parents should, want to know and want to feel comfortable that their children are safe.
Thank you again, Dr. Nickins. We do have a question. Kathy Mohammed asked the question of, so many people are wearing masks outside. Is it necessary when you're outside to wear your mask?
Yes, thanks for the question. And I can't say enough, there's so much difference in how people react to something that it's confusing. So I hope to give you the most conservative perspective and to help not make this a right or wrong thing. The idea of wearing a mask is to cover your nose and your mouth, where the moist droplets that become aerosolized when you breathe and speak or cough, in that spray, if you will, if you are infected, you contain virus. Okay, you have virus, and that can flow. So if you're outside and you're talking to someone, even if if you're talking to someone, you're exposed to that risk. Okay, the idea is that if you're outside and you're keeping some reasonable distance, people don't throw that spray, talking or coughing in such a way that it's a high risk. It's not zero, but as long as you are at least 3, and the recommendation is 6 feet away from someone, then you don't, then wearing a mask is probably not changing your risk of infection, even if someone out there has the disease. However, as we know, when you're out and about, you may run into someone that it doesn't, or someone, a child falls on their bicycle or something. And there are a lot of things that happen that spontaneously you may find yourself compromised. And so some people just feel more comfortable that they don't have to think about it. They're just wearing their mask. They become very comfortable and feel more confident by wearing a mask. So while the mask can be a protection for the individual, it also protects the person that they would encounter. So there's a primary protection, but there's also a consideration to the people around you for wearing a mask. But again, wearing masks outside, if you're able to properly distance, the mask is not a substantial additional barrier to transmitting the disease. But no one should feel offended by someone who feels more comfortable wearing a mask. And on the other hand, so people that wear masks, as long as you keep that distance from other people, you shouldn't feel that people not wearing a mask are a threat to you when they're, 6 or more feet away. I just wanted to make a couple comments about what I think has been some confusion, and others have pointed to saying, oh, they were wrong, or they made mistakes, or they were misleading, etc. But please understand, this pandemic, and I was trying to get across this idea that the virus is a live structure and it wants to live. So it has the ability itself to change in what we call mutation. So things that we know about the virus, as we learn, we have to adjust to what we thought we knew yesterday. We may have new information or better information that allows us to protect ourselves. And so what is new is, originally, once properly vaccinated, 2 doses for the mRNA Moderna Pfizer vaccine and 1 for the Johnson vaccine, that you have fairly high protection against getting infected, and therefore a mask may not be necessary. But the Delta variant has proven to be more contagious than the original virus. So again, if you catch the virus and you've been vaccinated, the likelihood of your getting severe infection is low. But especially since you've been vaccinated, if you're exposed, you can carry that virus and not have symptoms or have very mild symptoms. So the return to wearing masks, even if you are doubly vaccinated, has to do with understanding that the Delta variant, which is out there now, it's here in Maryland, it's in it's North and South America. It's quite prevalent now. Because of the Delta virus, even if you are completely vaccinated, 2 doses or single dose Johnson & Johnson, there's a possibility that you can have an infection, low-level infection, not be sick, and that you would transmit to someone else who perhaps thinks they do. People are not wearing a mask because they don't think that they're at risk. They're not, they're indoors. They think they have enough space from you, or they know that you're vaccinated and they feel, well, since you're vaccinated, you're not carrying the virus, etc. So again, it's just upping as we learn information, trying to be as safe as possible. The lucky thing for patients that are vaccinated is that the likelihood of them becoming severely ill is really reduced 5-7-fold by having the vaccination. But it does not, with the Delta virus, it does not prevent you from becoming infected, being infectious to other people.
Thank you, Dr. Nickins. One more part to Kathy's question was, she wants to know, why are those who have had the vaccine getting reinfected?
Yes. So again, so the way these vaccination works is that it's not an all or none. It means that if you're exposed to the virus, your body has an immune system that has been trained through the vaccinations to recognize the coronavirus specifically, and it eradicates the virus quickly. And the ability of the Delta virus to invade is so rapid that there is a period of time that you may be, your immunity that has been boosted by the vaccination. It will prevent you from becoming ill, but the Delta variant is high enough that it's possible that you transmit. So yes, so if you have been infected by coronavirus, you can be reinfected. And for, to understand that it's like getting a cold. And the fact that coronavirus is much like a cold virus. But if you, some people go an entire season and never have a cold, but others get colds once, twice, 3 times, varying degrees. But so the same thing with this virus. Having had the virus doesn't mean that you can't get it again. However, what we do know is that the vaccination is a great protection over having never being exposed to the virus. If you have not been vaccinated and you've not had the coronavirus, you should certainly be vaccinated. And again, it doesn't prevent you from being exposed or infected. It prevents you from becoming severely ill, hospitalized, and or die. If you've had the coronavirus, it does give you some protection. In fact, you get a higher anti-neutralizing antibody by having been infected than you do by the vaccination. However, if you've been infected by coronavirus, if you get a vaccination, your level of neutralizing antibody is even higher than 2 doses of the vaccination. So even if you've had the virus, you are recommended to get vaccinations, okay? Again, it's not that the vaccinations prevent you from getting infected. That's not the 95% that we're talking about, near 100% that we're talking about. It's talking about severe illness or hospitalization. We don't want anybody to get sick, but having a cold or having some symptoms of the flu for 3 or 4 days and you fully recover is not, it's not that we want you to be ill, but that's an acceptable outcome because it's not long-term. It's not a long-term disability. And that's what these vaccinations do. I hope that answers the question.
Absolutely. Thank you so much, Dr. Nickins. We are so honored and privileged to have your expertise here with us today. Next, I would like to, and if anyone is listening out there, if you have some questions, please continue to type them in the chat box and I will respond and ask the panelists. So next, I'd like to bring on Doctors Peters and Peters. They are out there on the front line. They are a married couple that are tackling the virus out there every day. I'd like to know from you guys, Dr. Peters, Rick Peters, and Terry Peters are their names. We hear a lot about hesitancy, about taking a test and getting the vaccine. How do we empower people to conquer their fears over the vaccine and what some of their thoughts may be concerning that?
Well, I think my main issue is getting to understand where our fears come from. I have a book called Medical Apartheid. And in Medical Apartheid, it talks about incidents in the medical community that have been done to African Americans from slavery to today. So there's much more to the fear other than just Tuskegee and Henrietta Lacks. So we've had plenty of issues and things in our past to have the fear. So I guess the first thing is to acknowledge that we understand why you are fearful. And then start to address the fears and the issues and the miscommunication and the misinformation that is actually catapulting their fear. And so we start that by first saying also, you need to trust your healthcare professionals. So when you look at these issues where we are on the front line as pharmacists, and we're hospital pharmacists, and with our own pharmacy, we're in the community. So even at the hospital, when wasn't mandatory for us to take the vaccine, but almost everybody in the hospital had a high rate of compliance, except for the African Americans. And most of them had fear. They had conspiracy theories. And then they also had their own issues and experiences where they felt like, I shouldn't do this. So it was even part at that point where we had to focus on the fears of our employees and getting them to understand the importance of this situation, the importance of a public health issue that we're in. This is a public health crisis, and explain the whole process to them. First by understanding their fears, and then by explaining it to them. And some of the key issues start off with, the questions on technology and how did they do this so fast and this and that. And I think what I use there, and I still use today, is I was walking down the hallway at the hospital one day, and a physician stopped to talk to me and asked me some questions. And we were dialoguing about a patient. And behind her head, I noticed pictures on the wall in Heritage Hall of the hospital that I work at 100 years ago, treating and taking care of people from the pandemic, Spanish flu from 1819 and 1820, 1818, 1920. And I decided that later on that day to look up. I said, I wonder, did they have a vaccine back then? What were they going through? And that's where I encountered the blessing that we have today. The blessing that we have evolved technologically and medically, that what they could not figure out at that time. At that time, they figured it was bacterial, and virology was in its infancy. So some of the issues that they had were the vaccines that they created were not working because it was bacterial only. And they didn't really create and get a chance to advance into more concepts and understanding of virology 2 years later. Recent years, but again, years later, 1925, 1922. Look how many people had died while they were still doing that. And we were able to come up with this technology quickly and save a lot of people. So first is explain to them the blessing of the technology. How would they not think that we would be more technology advanced in 100 years? I mean, right now you get a cell phone, and before you can finish paying on a cell phone, they already have the next generation of the cell phone. Cell phone technology is not the only people that have made advancements. We have made advancements too, and we have a blessing in front of us. And that's one of the biggest ways that I explain to them, is that we have a blessing. I understand your fears, but technologically, these people did not have this 100 years ago, and a lot of people perished. And now in this day and time, I mean, the only thing they had was mask. Here's a advertisement, a message featuring a Red Cross nurse and prevention instructions appeared in a U.S. publication in the current news in 1918, using a Red Cross nurse to show them how they should focus on protecting themselves wearing masks. That's all they had. Yet we have technology, we have better masks than they had then. We have discovered great things in virology, medications, also expand with them on the concept of the technology. Messenger RNA is something our body does already. Protein synthesis in our bodies uses messenger RNA. Look how we were able to technologically allow biology to bring us to the next generation. So I try to focus on the hesitancy by talking about understanding their fears, trusting our healthcare professionals, and letting them understand the blessing of the evolution of medical and biological sciences within 100 years.
Thank you, Dr. Peters. And I also have a question from Janelle Welch, who is watching. Either one of you may be able to answer this question. Janelle wants to know, is there a way to boost your immune system besides getting the vaccine? Is vaccination the only solution?
Right now, vaccination is a solution. But one of the things, as you can see behind me, we promote prevention. And we have a whole line. Actually, when this virus first came out and we really didn't know what to do, I actually did some research and I was beginning to put together immune boosting protocols, stuff you can buy right from the supermarket. If you know of anyone that was in the hospital, the first thing everybody was put on was zinc and vitamin C. So I took zinc to another level. I told everybody, buy Coldies, put it in your mouth, let it dissolve. And if it tastes terribly bitter and metallic, your immune system is good. Does that mean you shouldn't wear a mask? Absolutely not. Does that mean you shouldn't get vaccinated? Absolutely not. But I definitely would keep zinc handy during this season because zinc boosts your immunity, and you can do, without blood work, your own simple test to see if your immune system is good by checking your own zinc level, by tasting that Coldies has a product and Zicam has a gummy. If it tastes terrible, that's a good thing. If it tastes like candy, your immune system is weakened. We also encourage people to do things like 100 grams of white-capped mushrooms. That has vitamin D and is loaded with trace elements. All these things that you can get nutritionally from your foods and from supplementation to keep your immune system. If you can see behind me, there's a black container. That's nitric oxide. The biggest killer of people in the hospital is when their oxygen saturation percents get very, very low. This supplement will actually help keep your oxygen level elevated. Particularly good for people who are what we call long haulers, people who have survived COVID and now are suffering these what we call sequelae, or the after effects of being exposed to COVID, inability to breathe because of maybe some tissue damage because of the pneumonia that they had, or intubation. And one thing I want to say about intubation is not putting a mask over your face. Intubation is a surgical procedure. They actually have to put tubing that goes down your throat into your esophagus, and actually you have to be put in a comatose state in order to receive the medications that will keep you from paralytics. They call them paralytics. So you're paralyzed while you're being treated for COVID. Not a good place to be. And people need to understand, you're not getting a cold, you're not getting the flu. It's a deadly virus. And whatever you can do to prevent it, wear your mask, wash your hands, take your supplements, stay healthy, and get the vaccination. That just be well.
Thank you so much, Dr. Peters. And we do have others chiming in. What about vitamin D? A lot of people are taking CMOS. What about that? Are these other things to help to boost your immune system?
Yes, they're very helpful in boosting your immune system, yes. But they don't replace getting that vaccination. I got vaccinated. I took the Pfizer brand twice. I'm in a COVID hospital, and I'm very happy to say that neither myself, my husband, my daughter, or any other people that we educated have gotten COVID because they took the precautions. They take their supplements, but they got vaccinated as well, and they continue to cover their nose. Just so you know, your nose is filthy. There's a lot of nasty things in your sinus cavity. That's why they use your nose to test for COVID. The COVID virus gets into your sinus cavity and grows, okay? And once it grows, one sneeze, you can take out a whole room. And I say that when I go to the bank all the time, when I'm fussing at people about covering their noses. I say, your noses are filthy. And they found MRSA up there. They'll find COVID up there. And that's how people catch it, because it builds up to a certain level. Once it hits a certain level and enters your respiratory system, that's when you are officially infected. So the best way to avoid it is to mask, keep your immune system strong, and get the vaccination. I'm going to say it over and over again, and hopefully people will be willing to hear it and go ahead and get the vaccination.
And your supplementation shouldn't just come from supplementation. It should come from nutrition. Mm-hmm. So the positive thing is yes, supplements are great. We definitely, before the vaccine came out, we used our supplements to keep us strong every day before we walked out of the house. But we also indulged in nutrition habits. One, immune boosting habits. So we're eating foods that are rich in iron and calcium and vitamin D and vitamin C. And we're also not indulging a lot in fast foods and processed foods, sugars, sweets, which actually attack your immune system. There are no sodas out there today that doesn't have sugar in it. They all have high fructose corn syrup, which is worse than sugar. So also just giving your body good nutrition to start, the supplements actually coming in behind that to help boost an to boost the immune system with that. And then, of course, covering with your mask. And that's how we kept ourselves clean and strong until the vaccine came out.
Okay, Lolita Watkins is watching, and she wants to know, Dr. Peters and Peters, what foods specifically?
Dark green leafy vegetables. I have a beautiful chart that shows all the metabolic processes. And the one B vitamin, I think everybody should be on B vitamins, because they are the fuel that your body needs to build proteins. And you get those from your dark green leafy vegetables: kale, collard greens, cabbage, broccoli. We load up on that. That's my breakfast because I'm allergic to eggs. So I actually have a frittata without the egg. So broccoli, dark green leafy vegetables, you will be amazed at how much more energy you'll have when you eat more vegetables, drink more water, and eat smaller portions of meat. And definitely cut back, no sugar at all. Candy, cookies, cakes, every gram of sugar that you ingest depletes your immune system. So you want to eat things that are high in energy producing foods, like your folic acid is very important. So you get those from your dark green leafy vegetables. And it's good for your skin, your hair, your nails, everything. You will be so surprised how much more energy you'll have when you eat those types of foods.
You have to get away from the American diet, which the American diet pushes pretty much meat and protein. So, and if you can go anywhere, I think we went to Angela also Brooks's inauguration party, and we had like 2 hunks of meat, you know what I mean, and a plate full of carbs, and then we had like an ice cream scoop of vegetables.
Oh.
Thank you. Thank you so much, Dr. Peters and Peters. Having said all of that, we are still going to have people that are skeptical about getting the vaccine. I would like to listen to the viewers out there who has had the vaccine and that had a bad reaction. Her name is Denise Jenkins. Denise is one of our survivors that thrives. She has survived heart disease, open heart surgery, and she has survived a heart transplant. But when she got the vaccine, things went kind of bad for her. And so I'd like to introduce her to you now and have her talk about a little bit about what she experienced when she did get the vaccine. Denise, welcome. We are so honored that you're here today to join us. Can you tell us a little bit about what happened?
Hi, thank you, Florence. I really appreciate being a part of this. Yes, as you said, I had congestive heart failure, which sent me into, having an LVAD. And then this past December, I was blessed with a new heart, which was wonderful to have that all within the year. Sad to say, all within 2020, where everybody else was going through the COVID situation. I was going through my heart situation. But when I was able to get my first shot, which was I got my new heart in December. First shot I got was March 9th. Got the shot. Everything was fine. I got Moderna. Everything was fine during the day. Went to bed that night, but at 1 a.m., my husband found me just shivering. I was just shivering, and he didn't know what was wrong, and he tried to wake me. Well, I was actually having a seizure, and was taken to the hospital, actually to two hospitals. The first hospital, my local hospital, and then the other one, which was Inova in Virginia, where I got my heart transplant. Looking at my blood work, they were saying that one of my anti-rejection meds probably spiked my temperature, which sent me into a seizure. I was in the hospital for 3 days, actually lost a day in the hospital because I was out of it. But, came out of it fine. There was no damage to my brain. My neurologist said everything still looked good. And I was, fuzzy for about a week or so, but came out of it fine. Now, the second dose, I was on seizure medicine. And the seizure medicine kind of kept everything even for me. And the second dose, I didn't have any reaction to whatsoever. I am now with my transplant team. They want me to get of course, the third shot, which I will be put back on seizure medicine again for a week and then take the third shot. But I will get the third shot. I am definitely immune compromised. I am one of those people who do, when outside and around people, have a mask on because I am immune compromised. My kind of issue with people asking the question about why do people have masks on outside, it's like you have no idea what their health condition is. I was a personal trainer for 20 years and worked with people with heart disease, worked with people with diabetes, knew how they had to struggle with certain health issues. And of course, they never told anybody. They told me, and of course, I didn't share with anybody else, but I knew their health condition. So going into a gym where you have people who are coughing, not in their elbow, and at that time, without masks or anything, was hazardous to everybody. And we did clean and everything. And those people who I saw constantly were coughing and sneezing like that, I suggested, how about the elbow? Or would you like a tissue? Because like you said, the doctor said, this virus spreads quickly, just like the flu. And people don't seem to get that for some reason. So again, I was blessed to go through all I went through in 2020, but then also blessed to be able to have the vaccine and, survive the seizure, which was not pleasant, but I survived it. And like I said, I will be getting the third shot.
Thank you so much, Denise, for sharing your story. Awesome. So now some people may look at this and not knowing her full story may say, well, see, she got the vaccine and look what happened to her. She ended up in the hospital. Any of you guys on the panel, I'd appreciate it if you would like to interject here and have any feedback concerning Denise's experience with the vaccine. Just unmute yourself.
So this is Patrice. Denise, thank you so much for sharing your story. So we try to pre-identify folks that are at risk for a severe reaction, potential reaction to the vaccine. The it seems silly to say when we're talking to someone who had a severe reaction, and if your husband had not been astute and acted, things might not have turned out so well. But again, these reactions are treatable. And, unfortunately, we started this session with the real story of an person who was healthy and going about her, usual daily activities, and was found to be a little short of breath, low oxygen levels, and within 7 days she was gone. And it's balancing these terrible risks of the infection, which can be deadly, versus the protection against this infection with often rate limiting side, not adverse events that, so we don't want them. They're fortunately rare, but they can occur. And gosh, with rare, there's again, if there's any reason to be concerned that there's a reaction, you can arrange to make sure that you're getting your dose and that you're being observed. You're in a hospital setting, emergency room setting, et cetera, to make sure that you have medical access as needed. But again, I think not only, as we've heard, Denise survived, but she's had her second dose without reaction, taking again, precautions to prevent that same reaction. And because of her own risks, will have a third dose. So I'm so glad that she shared her story. And so, yes, as people have heard, it's important to acknowledge there are some risks, but the benefit from boosting your immune response to protect against this virus far outweigh these potential side effects.
So I would also like to say that I'm very happy that you shared the story with us. And the stories are needed. First, from what the doctor just said, everything in our field is based on benefit versus risk. Everything, surgeries, prescription medications, everything is based on that. Bringing drugs to the market. I had an interview with the FDA, and one of the questions they asked me, if we have a product or a drug on the market that we can bring to the market that we're studying that can save 20,000 people, but 5,000 people may die, would you approve it? They're going to approve it based on the benefit that we could save 20,000 people. And my answer to them was, yes, I would approve it. But also, I would continue post-marketing studies to find out, well, we saved 20. And you said like 1,000 people would die. What can we do to save those other 1,000 now? Let's approve it. And then let's continue our research to say, hey, what is it that caused these 1,000 people to have this incident so we can save all of them? Every drug on the market has side effects. You watch TV, you'll see that. They have one on eczema, and the first thing you see is fungus, cancer. You know what I mean? Every drug has side effects. Everything you ingest has a possibility of having side effects. There are also interactions. Grapefruit can interrupt the absorption of a lot of hypertensive medications. So, and cholesterol medications. So side effects are there. You can, just because vitamins, or even what we call everything natural, it can help us, yes. But taking too much of it can cause negative side effects. So our whole existence is based on a balance. I think your team was great to monitor and to think fast at your alternatives and to continue to monitor you. And definitely look at the benefit versus the risk. The actual catching COVID with your profile would have probably been worse than just catching a side effect and then having the team follow up quickly to resolve that. So we need your story, because we do need to know. Remember, this was partially studied and then sent out to the market because we saw, and this is not new. During the AIDS virus, people were dying like crazy. And they were like, the only antiviral that was out at that time was killing people faster than the virus. So they marched on Capitol Hill and they marched on governments until they look, can you get something out here to help with this virus? And we developed, the medical field developed something, and the FDA again released it early so we could start saving lives during the AIDS crisis.
And now some of the drugs are actually curative.
Right.
Now some of the AIDS drugs are curing and preventing transmission. We could be on to something because of your case. Your case could have saved people's lives. Now they know if they have a transplant patient who's on immunosuppressive drugs. By the way, people, when you get a transplant, they put you on drugs that purposely reduce your immune system so that you don't reject the transplanted organ. That's the part that needs to be told in this story before people make a judgment against the vaccination. She's already on medications that suppress her immune system. So she has to get the shot, because if she gets COVID, she will not survive. She would not have survived. This fast action of her group, her team, they were phenomenal. That you are very blessed to have an excellent team.
Blessed.
I agree with that. Kudos to your team, because you didn't have a mild side effect.
No.
Seizure is major, and you lost a day, according to you. So they stepped it up, and they saved your life once by getting that heart, and we're not taking the risk of losing you to a virus where we have a vaccine. So I applaud them as well.
Great job, panelists. Thank you so much, Denise, for sharing your story that needs to be told. Denise continues to have stories that need to be told. And I'm glad you chimed in, Dr. Martin, because my next question has to do with the ER. To be honest with you, I was recently in the ER and it was like a zoo. I went there along with a family member who was ill. It was so crowded. They asked some of us to step outside if we're not being seen. If you are here accompanying someone, please step outside. There's not enough seats. And she continued to say the ER is full. We have over 100 beds that are full. Every hospital in the area is full. And I felt like, oh my God, what are people supposed to do? It made me feel bad for my family member. Do we just go home? What types of things are you seeing in the ER, Dr. Martin? Can you share a little bit about that?
Sure, Florence, and thank you again for having me here. I literally just left the urgent care seeing patients, and what you just described is true. The emergency rooms are packed full of patients, most of them with COVID-type symptoms. And how did we get there? A lot of it is because patients people aren't getting vaccinated. And so we're transmitting this virus at a very high level. Some of it's because individuals have symptoms which they ignore or think is just my allergies, or I always have a cough. And they're transmitting the virus and have been, because they've been infected themselves. And then the kids are back in school now. So they're back in school in an environment where they're not vaccinated. In some areas of the country, there's no mandate for a mask or for the teachers and staff to be vaccinated. And it's hard for the children to keep their mask over their noses. So we're seeing a lot of children coming in now that have showed up at school with coughs, runny noses, and sneezing, etc. And we have to also impress upon the parents, if your child has a symptom at all, keep them home from school. Some of it's the parents don't know all the symptoms, and some of it is they know, but let me just try to slide them in anyway. So it's very busy in the emergency department. If you look around the country, there's a shortage of beds. There's a shortage of nurses. So what's the point of having the bed if there's no nurse to take care of the patients? So it's a very trying time, and we need the public's help in combating this virus. If you can get vaccinated, get vaccinated. It is working to bring down hospitalizations, bring down illnesses. But unfortunately, this is where we are right now.
Wow. Thank you so much, Dr. Martin, for shedding some light on where you are right now in the hospitals. I was shocked because I hadn't been to the ER in a while. So I was totally at what I witnessed. Right now, I do have one question. Go ahead, Dr. Martin.
But I also want to impress upon those who have medical emergencies not to hesitate coming because you're afraid of catching COVID. I know so many people who don't come who experiencing potential cardiac events, or maybe they have COVID and they're short of breath, or don't know they have COVID, but they do. They're short of breath or whatever, strokes. People are afraid to come in who really, really need to come. So be assured that we take precautions at the hospital so that to keep the transmission down. But if you really need the emergency room, and if you're not sure, talk to a nurse or someone and get the treatment you really need.
Thank you for making that point. Very, very good stuff. Dr. Peters, as you were talking about some of the preventive measures and things to do, let's see. We have Alexis Lawson who is listening, and she asked the question about a nasal rinse. Is that something to help to either cut down the likelihood of catching COVID or help to prevent it?
I would say you have to be careful with that, because what you don't want to do is flush the virus into your throat, because then it can gain access to your digestive tract, your throat, and they have 92 symptoms associated with COVID, and one of them is thrush. So you can suddenly get thrush in the mouth, and I don't know that that's a good idea. Rinsing your nose, I would maybe wipe it out rather than use a rinse, especially if you suspect you have COVID. But definitely keep the nose clean, and you can certainly do that with the, just a little Q-tip to clean the area, or maybe I would actually even use Listerine. I mean, you can just clean the area gently, but I wouldn't necessarily rinse, especially if you suspect that you have COVID. You don't want to flush it into your body. You want to get it out. Blow your nose, blow it out of the nose, not inhale anything that could go down in your throat.
Thank you, Dr. Peters, so much. And so I'd just like to know at this point, if there are no more questions from our viewers, are there any closing final thoughts you'd like to tell the public, people who are trying to do the right thing, people that are hesitant, any final closing thoughts at all? Let's start with you, Dr. Nickins.
Thank you again. This is a contagion. This is a pandemic that depends on each of us being responsible for ourselves and for each other. It's all of us. Vaccination should be the top of your list unless you have some contraindication, and most medical conditions put you at risk, that you have even greater need, greater protection from getting, need to be protected from getting infected. So vaccination is top of the list. The social distancing and masking, et cetera, these are all very useful things, but nothing takes the place of the vaccine. The vaccine offers the possibility of return to normal. And so exciting in the near future is that our children 5 to 12 will have vaccination available. But again, I want to thank everyone for sharing their stories and listening. And hopefully, if you haven't been vaccinated, you will. And please take your message of confidence and the need for vaccination to your family members and friends, because, as I said, it's all of us. Thank you so much.
Thank you, Dr. Nickins. Dr. Martin, any final closing thoughts?
Yes, for those of you who can get vaccinated, like Dr. Nickins has just said, please get the vaccine. For those of you who, for whatever reason, are not getting vaccinated, at the very least, mask, social distance, and pay attention to your symptoms. If you have any symptoms of COVID, isolate yourself. Don't congregate. Get frequent testing. These are all at our disposal. And if you don't know the symptoms, let me go through them. Fever, cough, shortness of breath, nausea, vomiting, diarrhea, headache, sore throat, loss of taste and smell, body aches, fatigue, and even allergy symptoms. You can have all of those, one of those, or none of those. That's what makes this so serious. So pay attention to your body and pay attention to the fact that we need to all, like Dr. Nickins said, we're all in this together. It's going to take all of us to get through this.
Thank you, Dr. Martin. And Dr. Peters and Peters, any final closing thoughts you'd like to
Sure.
tell?
Yeah, sure. In reference to vaccine hesitancy, stop listening to non-medical professionals.
Please.
And trust your medical professionals. There was a sports star that said on TV when they asked him, when are you going to take the virus serious, COVID serious? He said, or vaccine serious. He said, well, when I get COVID, then I'll worry about the vaccine. Just standing there in front of all those people, pushing out information. Vaccine is not the treatment. You know, another celebrity talked about going to, we were like lamb going to the slaughter. And I say, just look at the line at the Chick-fil-A and the McDonald's. That's going to slaughter right there because you're eating processed food. You don't know what's in it. There's tons of chemicals in it. McDonald's French fries, they can't even produce the same formula in Europe that you do in America, which has 14 different ingredients in it because Europe doesn't allow some of the chemicals that we allow in our food. So you're killing yourself slowly from my own food, eating TBHQ, dimethyl polisiloxane, all of these chemicals every day that are leading you to hypertension, diabetes, cholesterol issues, all of that, and killing yourself slowly. Yet we're in a pandemic where something can kill you immediately, and we have something that can protect you from that, and you're going to ask me what's in it.
I had someone say to me, if you get the vaccination, you can get small clots in your small artery, your small blood vessels, and it can lead to a stroke. I said, if you get COVID, you will have a stroke because it forms clots in the brain. You will have a pulmonary embolism because it forms clots in the lungs. You could end up with an aortic valve problem because it forms clots there. I said, it's so much so that they test you a D-dimer to see if you have a clotting risk, and they put you on heparin and Lovenox, which are what's called anticoagulants as prophylaxis when you're in the hospital. So between being paralyzed, being on blood thinners, being on fentanyl drip to keep you from pain, keep you on midazolam drip to keep you in a state of paralysis and muscle relaxation. Most people aren't even eating, so you're also nutritionally starved. This is not the COVID that you want. And also the tube that's stuck down your throat being intubated. It's a surgical procedure. It's not air getting blown into your lungs. Very serious. And that's the trade-off that you want to get for a vaccination, really? Minor discomfort, take your immune supplements, take your Tylenol, get some rest, drink more water, and that will help. Most people in the emergency room, and Dr. Martin can attest to this, have to immediately go on sodium chloride solution IV because most people come to the emergency room dehydrated. Drink water. You'll flush most of the waste out from yesterday. So just, just things you can do that are common sense things that you don't even think about that can make a huge difference. And don't hesitate, vaccinate. That's the last thing I have to say. Don't hesitate, vaccinate.
All right, Dr. Peters and Peters, you brought it home for us. Any final closing thoughts, Denise?
Yes. All I can say is all that I went through last year with my heart issues, which I think in a normal time, it was still going to be stressful for me. And talking about the tube and all that, been through that twice. Not fun, but the risk of me taking that vaccine and possibly having side effects, which I did, was more important for me to take that vaccine than to possibly infect my family, infect anybody that I was around. Not that I was around a lot of people after the heart transplant, but it's important. And it's not just for me, it's for my community. It's for all the other people I love in this world. So, you not getting vaccinated is not helping anybody. It's killing people. It's killing people. And all I can say is thank the Lord we have the medical professionals out here who are doing the work and working hard to make sure we are getting what we need and taking care of us.
Thank you. Thank you so much, Denise. And thank you to all of our panelists, even Jackie Mims, who had to leave a little bit early, who shared her heart-wrenching story of the loss of her mother due to COVID. And we just thank you. We honor you. We're glad you're still here with us, Denise. Thank you to the medical professionals, like you said, that are out there in the trenches on the front line, doing the hard work, seeing this every day. Dr. Martin, Dr. Peters and Peters, and Dr. Nickins, who's doing the research and out there in the front line of this, trying to make sure that we all get over this hurdle and we all do what we need to do in our part. I've received some messages that this has been very informative, very educational. I hope this has made a difference to someone to go out there and get vaccinated and do what they need to do. Alexis says, Dr. Peters, you brought it home. That's Dr. Peters. She's very frank in her speech always. So, and to each of our doctors on the panel, we thank you so much for your expertise and your time. Tune in again next month. We do this every month, supporting our sisters and supporting our community, actually. So tune in next time. We'll have a different topic next month. But thank you, guys. And thank you out there in Facebook land for watching. And have a good night.
Thank you.